Good afternoon, everyone. So, presentation title is Prognostic Insights and Genomic Landscape of Mitochondrial Dysfunction in Keratoconus. There is no financial disclosure to disclose. So, keratoconus is most common corneal ectasia, involves progressive thinning and steepening of cornea. It is irregular and bilateral and asymmetric in nature. So, the exact etiology of keratoconus is not known very well yet, but there are molecular evidences which suggest that there is dysregulation of oxidative balance and mitochondrial dysfunction in keratoconus corneas. These are some clinical signs of keratoconus: Munson sign, flesh-showing, rigidity signs, and Vogt stripe. So, oxidative stress can be of two types, like from endogenous source or exogenous source, which will lead to the generation of reactive oxygen species and reactive nitrogen species. In response to that, cell will generate lipid and nitrate peroxide enzymes and antioxidant enzymes to combat the oxidative stress, which will lead to the production of oxidative stress and oxidative damage in the cell. And the next step is activation of degradative enzymes, mitochondrial DNA damage, or corneal thinning if not properly combated with this oxidative stress. So, during the oxidative stress, which I described in my previous slide, the mechanism involved in keratoconus cornea is there is a production of abnormal antioxidant and peroxidation enzymes, due to which there is accumulation of reactive oxygen species and reactive nitrogen species, which will lead to oxidative damage. And inside the cell, there will be a reaction with the proteins and phospholipids, which will convert them to degradative enzymes. There is mitochondrial DNA damage, apoptosis, and corneal thinning. And this process will go on, and there is more accumulation of reactive oxygen species and nitrogen species, because these are not eliminating by proper enzymes, production of proper enzymes. Now, whereas if we talk about the normal cornea, there is a production of proper antioxidants and lipid peroxidation enzymes, which will eliminate this oxidative stress. So, there is no oxidative damage or stress inside the cell, and the cell will function normally. These are some literature evidences which shows that there is oxidative stress in the keratoconus corneas. So, our aim is to, we did whole mitochondrial DNA genome sequencing of blood and tissues from keratoconus patients. We also did ultrastructural analysis to look for the morphology of mitochondria in corneal tissues, and then we did expression level check of oxidative stress genes in corneal tissues of keratoconus patients. We recruited total 20 keratoconus patients, and we collected blood and cornea from same patients. Corneal tissue was also processed for transmission electron microscopy, and then we did quantitative real-time PCR to assess the gene analysis of oxidative stress genes. These are the demographic details of these 20 keratoconus patients with male preponderance in the study. 70% of the patients were male, and majority of the patients, like more than 70% of the patients, have the habit of eye allergy and eye rubbing. There is 35% of the patients have only family history of keratoconus. Coming to clinical phenotypes of these patients, the Munson sign and Vogt stripe are present in majority of the cases, more than 70%. Whereas flesh-showing is present in 55% and rigidity sign is present only in 15% of the cases. The thinnest pachymetry recorded was average is 415.86 plus minus 85 microns. Now, coming to ultrastructural analysis results. So, the mitochondrial morphology of normal cornea, which shows proper and healthy mitochondria inside the cell or epithelial layer. The cristae and the double layer mitochondrial structure was properly identified. Whereas if we see in the keratoconus corneas, there is hollow, swallow mitochondria were recorded. All the mitochondria were either hollow or swollen in nature. They are cylindrical in nature, but not proper healthy mitochondria were identified or recorded in the epithelial cells of keratoconus tissues. So, it confirms that there is a mitochondrial damage at morphological level. Next, we go for DNA isolation, followed by their whole mitochondrial genome sequencing. So, we found out that there are variations in all the samples. Total more than 500 variations were found out. Majority of them was transition type of variations, like adenine to guanine or guanine to cytosine. So, majority of the variations, these are the highlighted one variations which are repeated in many of the samples, like variation at position 4769, adenine was converted to guanine in 13 samples of both blood and tissues. Similarly, at position 15326, adenine again converted to guanine in 12 and 10 cases of blood and tissues. And we are doing mitochondrial sequencing on more samples to conclude these variations at protein level, if there is any amino acid change or protein changes in this keratoconus corneal tissues. Then we also isolated RNA from these samples to do the quantitative real-time PCR for analyzing and identifying expression of these genes. So in our samples, only PRDX6 gene was upregulated in majority of the cases, whereas all the 3 genes were downregulated. Then we correlated these genes with clinical parameters. So eye rubbing and Munson sign was correlated strongly and statistically with PRDX6. Again, SORT2 was correlated with eye rubbing, Munson sign, and eye atopy. Similarly, NRF2 and GPX4 was also correlated strongly and statistically with Munson sign, Vogt striae, and eye atopy. So this is the first of its kind of study to provide information of mitochondrial DNA mutations in Indian population, and majority of the variations are novel, and rest of them variations are reported in numerous ocular and systemic diseases. We also found the damage and irregular morphology of few mitochondria in corneal tissues and keratoconus patients. mRNA expression levels suggest that there is downregulation of antioxidative genes, and this again indicates there is mitochondrial DNA damage. So we will recruit more patients to evaluate mitochondrial DNA as a genetic risk factor in contributing and progression of keratoconus. Thank you.
What is the inciting factor for mutation?
Sorry?
What is the inciting factor for mutation?
We did, these are not proper mutations yet, these are just variations. If these were concluded to protein change, then we can call it for mutations, and it will come to the progression or development of keratoconus. So we will say that these are markers.
Is it a cause or a effect?
Sorry?
Is mitochondrial mutation is a cause or effect of keratoconus?
No, it can be cause or effect. It will result in cause and the progression both, maybe. Thank you.
Mr. Shivam, you are an AIOS member?
No.
Because it's labeled as Mr. Shivam, so you are a ophthalmologist?
No, not basic science, basic
okay.
research.
Okay.
Thank you.